Hi guys, welcome back to Code Master Coach, your medical coding tutor. Okay guys, today we are in chapter 4 of the 2024 official coding guidelines for ICD-10-CM. So let me minimize my box and let's see what we're talking about here. In chapter 4, we are on endocrine, nutritional, and metabolic diseases. So let's look at my outline first because you know I always start with notes. And first I want to say that the type of diabetes, type 1, type 2, and secondary are the category. Those are the first 3 digits of the code. So for example, E08 is for diabetes mellitus due to underlying condition. E09 is drug or chemical-induced diabetes mellitus. E10 is type 1 diabetes. E11 is type 2 diabetes. And E13 is other specified diabetes. The presence of any associated complication with the type of diabetes is the 4th character. And then further specificity of the complications will be the 5th, 6th, and 7th character after the first 3, the category code. And then just make sure you know that there is a difference in coding of borderline diabetes versus diabetes, or pre-diabetes, or latent diabetes. Those are found under the symptom code, R7303. So they're not actually true diabetes, but they're borderline or pre-diabetes or latent. So again, those are under the signs and symptom. All right, so that leads us to our first guideline under diabetes A, types of diabetes. We're going to go to the guideline because remember up above I stated the different types of diabetes. So let's review what the guidelines say about the types of diabetes. And notice it says the type of diabetes and not whether the patient is on insulin. So let's look at the guideline on that. A, the diabetes mellitus codes are combination codes that include the type of diabetes mellitus, the body system affected, and the complications affecting that body system. As many codes within a particular category as are necessary to describe all of the complications of the disease may be used. They should be sequenced based on the reason for a particular encounter. And then it says assign as many codes from categories E08 through E13 as needed to identify all of the associated conditions that the patient has. So then when it gets to type of diabetes, which we're covering now, the age of the patient is not the sole determining factor, though most times type 1 diabetics develop the condition before reaching puberty. So for this reason, type 1 diabetes mellitus is also referred to as juvenile diabetes. So going back to my handout, I just stated on here the type of diabetes and not whether the patient is on insulin, and then type 1 versus juvenile, because remember the train of thought is diabetes type 1 is when your pancreas is unable to produce insulin. Therefore, these patients take insulin. That used to be the rule of thumb in the end. It was automatically understood that because their pancreas was not producing insulin, they had to go on insulin. But make sure you understand the type of diabetes and not whether the patient is on insulin, because a type 2 diabetic, which means that their pancreas is producing, but it may not be sufficient enough for the body, or something later on in life happened to cause your pancreas not to produce the insulin needed, then you may go on insulin at a later date. So whether you're type 1 or type 2 does not depend on whether or not you're on insulin. It is understood that type 2 diabetes usually is controlled with diet or oral meds, but there are times when type 2 diabetics have to go on insulin. So just because a patient is on insulin, don't automatically assume they're a type 1 diabetic. That is not the case. And then the term juvenile does not mean type 1. Yes, usually most type 1 diabetics are young. They realize in the early, right after birth, that something's wrong. And by the time they reach puberty, like the guidelines say, they realize these patients' pancreas is not producing insulin, and therefore these patients do go on insulin. All right, don't want to stay on that one too long. Let's go to number 2. Types of diabetes mellitus not documented. If the type of diabetes mellitus is not documented in the medical record, the default is E11, type 2 diabetes. And I think I put that same note. If the type of diabetes is not specified, automatically go to type 2. If they don't say it's type 1 or secondary, automatically go to type 2 diabetes to designate what type of diabetes this patient has. The default is type 2. Let's see what number 3 says. Diabetes and the use of insulin, oral hypoglycemics, and injectable non-insulin drugs. Right, this one changed in recent years. If the documentation in a medical record does not indicate the type of diabetes, but does indicate that the patient uses insulin, then code E11, type 2 diabetes, should be assigned. Remember, we just said in the previous guideline, if the type is not designated, automatically assign it to type 2 diabetes. Then additional codes should be assigned from category Z79 to identify the long-term current use of insulin, oral hypoglycemic drugs, or injectable non-insulin diabetic as follows. If the patient is treated with both oral and hypoglycemic drugs and insulin, both codes Z79.4, long-term or current use of insulin, and code Z79.84, long-term or current use of oral hypoglycemic drug, should be assigned. Remember, this has changed. In the past, it was if you were on both, only code the insulin. But now if you're on the oral, you take an oral tablet and you take insulin, then code them both. If the patient is treated with both insulin and an injectable non-insulin anti-diabetic drug, then assign code Z79.4, long-term or current use of insulin, and Z79.85, long-term or current use of an injectable non-insulin anti-diabetic drugs. If the patient is treated with both oral hypoglycemic drug and an injectable non-insulin anti-diabetic drug, assign codes Z79.84 for the long-term current use of an oral hypoglycemic drug and Z79.85 long-term or current use of an injectable non-insulin anti-diabetic drugs. Note Z79.4 should not be assigned if insulin is given temporarily to bring a type 2 patient blood sugars under control during an encounter. So let me say that one more time. Code Z79.4 should not be assigned if insulin is given temporarily to bring a type 2 patient's blood sugar under control during an encounter. All right, that's 3. And notice here, I just made a quick identify the uses of insulin. Long-term usage, Z79.4. Long-term or current use of an oral hypoglycemic drug, Z79.84. And long-term or current use of an injectable non-insulin anti-diabetic drugs, Z79.85. And those of us that have gotten into like family medicine or internal medicine physicians that see a lot of diabetes, we almost have these codes memorized. And I always teach, don't memorize codes, but these you can help. You know when to use Z79.4 versus Z79.84 versus V79.85. All right, we're down to D, or number 4. Let's go back to the guidelines. Diabetes in pregnancy. Notice that this is removed. When we get to pregnancy, we're going to be coding quite a bit of information. So I just put on here future guideline because, again, those pregnancy codes take precedence, but we'll get to those later on in the guidelines. Let's look at 5. Complications due to insulin pump malfunction. All right, let's see what A. Yep, I went straight to the guidelines on this. Okay, so A, underdose of insulin due to insulin pump failure. An underdose of insulin due to an insulin pump failure should be assigned a code from subcategory T85.6, mechanical complication of other specified internal or external prosthetic devices, implants, and grafts, and that specifies the type of pump malfunction as the principal or first listed code, followed by code T38.3X6 for underdosing of insulin or oral hypoglycemic anti-diabetic drug. And it says additional codes for the type of diabetes, mellitus, and any associated complications due to the underdosing should also be assigned. So again, with this category, with number 5, a complication due to an insulin pump malfunction is considered a complication. And so you should be under main term complication when you're identifying that there was a complication in the insulin pump malfunction. So not under diabetes, under the main term complication. And then let's go to 6, secondary. Well, okay, now there's a B, the principal or first listed code for an encounter due to an insulin pump malfunction resulting in an overdose. Now notice up here it was an underdose. If it results in an overdose of insulin, you should be using T85.6 for the mechanical complication of other and specified internal and external prosthetic device, implants, and graft, followed by T38.3X1 for poisoning by insulin and oral hypoglycemic anti-diabetic drugs, accidental, unintentional. So notice you're going to use that poisoning for the overdose. Now we can go to 6, secondary diabetes. Now remember I said type 1, your pancreas is not producing insulin, therefore your body has to take insulin. Type 2, if your body is producing, it's producing very little or not enough, and therefore your body needs oral or special diets, etc., to help. Now with secondary, it's usually a cause and effect relation. Something's causing this. So codes under category E08, diabetes mellitus due to an underlying condition. E09, drug or chemical induced diabetic mellitus, and E13, other specified diabetes mellitus, identify complications, manifestations associated with secondary diabetes. Secondary diabetes is always caused by another condition or event. They gave you, for example, cystic fibrosis, malignant neoplasm of the pancreas, pancreatectomy, or an adverse effect of a drug or poisoning. So again, secondary diabetes is always caused by another condition or event. So A, secondary diabetes mellitus and the use of insulin, oral hypoglycemic drug, or the injectable non-insulin drug for patients with this secondary diabetes who routinely use insulin or oral hypoglycemic drug or an injectable non-insulin drug. Additional codes from category Z79 should be assigned to identify the long-term current use of insulin, oral hypoglycemic drug, or non-injectable non-insulin drug as follows. If the patient is treated with both oral hypoglycemic drug and insulin, then both code 79.4, long-term current use of insulin, and code Z79.84, long-term or current use of an oral hypoglycemic drug, should be assigned. If the patient is treated with both insulin and an injectable non-insulin anti-diabetic drug, assign code Z79.4 for long-term current use of insulin, and Z79.85 for the long-term or current use of injectable non-insulin anti-diabetic drug. And if the patient is treated with both an oral hypoglycemic drugs and an injectable non-insulin anti-diabetic drug, then assign code Z79.84 for long-term or current use of oral hypoglycemic drugs and Z79.85 for long-term current use of injectable non-insulin anti-diabetic drugs. Now look, code Z79.4 should not be assigned if insulin is given temporarily to bring a secondary diabetic patient's blood sugar under control during an encounter. So that practically drills that in your head. If it's just temporarily, do not assign that Z79.4. Straight from the guidelines, B, the same thing. So let's look at B. Assigning and sequencing secondary diabetes codes and its causes. The sequencing of the secondary diabetes codes in relationship to codes for the cause of the diabetes is based on your tabular list instructions for categories E08, E09, and E13. Because remember, these identify secondary diabetes. So it says secondary diabetes due to pancreatectomy, the removal of the pancreas. So for pancreatectomy diabetes, which is the lack of insulin due to the surgical removal of all or a part of the pancreas, you assign code E89.1, post-procedural hypoinsulinemia, and then you assign a code from category E13 and a code from subcategory Z90.41, acquired absence of pancreas, as an additional code because you're identifying the fact that the pancreas has been removed. And then if it's secondary diabetes due to a drug, then it says secondary diabetes may be caused by an adverse effect of a correctly administered medication, poisoning, or sequela of poisoning. So we've pretty much seen that when it comes to drugs. All right, so when we look back at our guideline for 6, it just says assigning of that sequencing secondary diabetes codes and its causes. So what I did here is I made a copy of the 2024 ICD-10-CM alphabetic index to disease and injuries, and I'm looking at the main term diabetes. Now notice when you come under diabetes, it's diabetes with, if there's some other complications. But the key here that I wanted you to look at, if it's due to or due to a drug or a chemical, see how you find those? Even if it's due to an underlying condition, you find those under here. And then if it's diabetes type 1, right there, find you're under main term diabetes, and you're going to go down to type 1. And if it's type 1 diabetes with any of these conditions, identify those. And then diabetes type 2. So I always highlight these so I make sure I don't mix them up if it's a type 2 diabetic or if it's a diabetes that the physician did not designate type 1, type 2, or secondary. Remember, the default is always type 2. So then if there's a complication, then I go there. But there's your type 2, E11.9. There's your type 1, E10.9. Okay, guys, hope that helps. Next week, we will be on Chapter 5, Mental Behaviors and Neurodevelopmental Disorders. All right, guys, thanks for following along with me. This is a slow process, I realize. So, and the numbers aren't really great on these videos. People aren't really wanting to follow guidelines. And I know these aren't always easy to follow. But those that are following along with me, stay with me. We're going to complete these 2024 official ICD-10-CM coding guidelines. Thanks, guys. I'll see you next week.